Genital herpes is a sexually transmitted infection (STI) caused by the herpes simplex virus HSV. There are two types of herpes simplex virus, HSV1 and HSV2. While HSV1 primarily causes oral herpes cold sores, it can also cause genital herpes. HSV2, however, is most commonly associated with genital herpes. Once contracted, the virus remains in the body for life and can reactivate periodically, causing recurrent outbreaks of sores or blisters in the genital areas. Causes and transmission: genital herpes is primarily spread through sexual contact. Vaginal, anal, or oral sex with an infected person can transmit the virus, even if they do not have visible sores at the time. This is because the virus can be shed from the skin even when there are no symptoms. Skin-to-skin contact. Direct contact with the infected area can't transmit the virus. Vertical transmission: mother to baby. The pregnant woman with genital herpes can pass the virus to her baby during childbirth, especially if she has an active outbreak at the time of delivery. The virus enters the body through mucous membranes or small cuts in the skin. Symptoms: genital herpes symptoms vary widely from person to person. Some individuals may not experience any symptoms, while others have painful outbreaks. Primary outbreak: first episode flu-like symptoms, fever, muscle aches, headache, and swollen lymph nodes in the groin. Painful blisters or ulcers. Small, red bumps or blisters may appear on the genitals, anus, thighs, buttocks, or surrounding areas. These blisters can rupture, leaving painful ulcers that may take a few weeks to heal. Itching or tingling. Some people feel itching, tingling, or burning before the appearance of sores. Pain during urination. Sores on or around the urethra can make urination painful or difficult. Recurrent outbreaks. After the initial outbreak, the virus lies dormant in nerve cells and can't reactivate, causing recurrent outbreaks. These are usually less severe and shorter in duration than the first episode. Triggers for recurrent outbreaks: stress, illness, fatigue, menstruation, or immune suppression can trigger a recurrence. Prodromal symptoms. Before an outbreak, some people experience warning signs, such as itching, tingling, or burning in the affected area. Diagnosis: to diagnose genital herpes, healthcare provider may use the following methods. Physical examination. The doctor may recognize typical symptoms, such as sores or blisters in the genital areas. Viral culture. The sample from an active sore can be tested for the herpes simplex virus. Polymerase chain reaction PCR test. PCR can detect HSV DNA from a swab of the affected area or from blood and is more sensitive than a viral culture. Blood test antibody test. Blood tests can detect antibodies to HSV1 and HSV2, indicating a past or current infection. However, this test does not determine the location of the infection, oral or genital. Treatment: there is no cure for genital herpes, but antiviral medications can help manage the symptoms, reduce the frequency of outbreaks, and lower the risk of transmission. Antiviral medications: acyclovir, valacyclovir, and famciclovir. These medications can shorten the duration of outbreaks, relieve symptoms, and reduce the frequency of future outbreaks. They can be taken during an outbreak or as daily suppressive therapy to prevent or minimize recurrences. Pain relief. Over-the-counter pain relievers such as ibuprofen or acetaminophen can help manage discomfort during an outbreak. Lifestyle modifications. Keeping the affected area clean and dry, wearing loose-fitting clothing, and avoiding sexual contact during an outbreak can help manage symptoms. Complications: recurrent outbreaks. While recurrent outbreaks are typically milder, they can still be distressing. Some people experience frequent outbreaks, while others may have very few. Psychological impact. The stigma and emotional distress associated with the genital herpes diagnosis can affect mental health, leading to anxiety or depression. Neonatal herpes. If a mother has an active herpes outbreak during childbirth, The baby may be exposed to the virus, leading to a potentially serious infection. In such cases, a C-section may be recommended to prevent transmission. Increased risk of other STIs. Genital sores from herpes can increase the risk of contracting or transmitting other sexually transmitted infections, including HIV. Preventing genital herpes involves reducing the risk of exposure and transmission. Use condoms. Condoms can reduce the risk of transmission but are not 100% effective since herpes can infect areas not covered by the condom. Avoid sexual contact during outbreaks. Refraining from sexual activity during an active outbreak significantly reduces the risk of transmission. Suppressive therapy. Taking antiviral medications daily. Suppressive therapy can reduce the likelihood of passing the virus to a sexual partner, especially for those with frequent outbreaks. Communication. Open and honest communication with sexual partners about herpes status is important for managing risks and making informed decisions about protection. Pregnancy management. Pregnant women with genital herpes should inform their healthcare provider, as they may need antiviral treatment late in pregnancy to reduce the risk of an outbreak at delivery. Conclusion: genital herpes is a common and manageable condition, though it can cause physical and emotional discomfort. While there is no cure, antiviral treatments can reduce symptoms and the risk of transmission. Practicing safe sex, managing outbreaks, and having open discussions with partners can help people with genital herpes maintain a healthy and fulfilling life. If you suspect you have genital herpes, it's essential to consult a healthcare provider for diagnosis and management.